Well, thank you very much for having me in today to talk about Social Security benefits. My name is Ivy Houghton. I'm a public affairs specialist with Social Security Administration. Although prior to coming to this position, I was a claims technical expert in the field offices. So I welcome any questions that you have for me. Those questions will be monitored through the chat. And I generally leave plenty of time at the end of the presentation so that I can answer all those for you. I'll kind of work through those slides. Hopefully, we'll get any questions that you have answered, but certainly if there's more questions at the end, please feel free to post those to the chat and I'll be happy to answer those. Without further ado, I normally cut my camera during the presentation just because it hangs up my slides a little bit, but I will pop back on once we get to the question and answer portion. So today's presentation covers all things Social Security. We will start by talking about our retirement benefits, and then we'll move to talking about spouses and survivors benefits, touch on disability and Medicare, and wrap up with our online services, and of course, plenty of time for those questions and answers. A conversation about Social Security, a good place to start that conversation is how Social Security is funded. And Social Security is funded with a payroll tax called the Federal Insurance Contributions Act. Now, when you work for an organization that pays into FICA, you might see it listed on your check as FICA. You might see it as OASDI. You might even specifically see it broken down as Social Security and Medicare. But this is a payroll tax that's deducted from a paycheck and it's matched by the employer, meaning the employee pays a portion and the employer pays a portion. The total amount is 15.3% of gross wages. 7.65% of that is paid by the employee, and 7.65% percent of that is paid by the employer. And then once we get that tax of that 7.65%, 6.2% of goes into the Social Security Trust Fund, and 1.45% goes into Medicare's trust fund. And this tax funds all things Social Security's benefits. So retirement, disability, survivors benefits, and of course that Medicare portion goes to fund Medicare's health insurance. Now, in addition to collecting that tax, while you are working and paying in, Social Security is tabulating something called credits. And these are essentially the building blocks of qualifying for Social Security retirement benefits. Now, you need 40 credits in order to be eligible to draw a benefit from Social Security. But how do you get those credits? Well, you earn those credits through work as well. And each year there's a dollar amount set that is equal to one credit. So for 2024, for every $1,730 that you earn, you receive one credit. Now, the interesting thing about this provision is you can only earn 4 credits per year. So you can see by earning just over about $6,900, you'll receive all 4 credits for the year. It doesn't really matter when you earn those. It can be in the beginning of the year, it can be spread out throughout, just kind of depends on how often you're working. But you might be wondering, well, I'm paying way more into Social Security than $6,900 a year. What's happening to the rest of my funds? Well, the additional funds that you pay in go to increase the amount that you receive from us each month when it's that retirement time. But while we're tabulating these credits, since you need 40 and you can only receive 4 per year, we generally say it takes about 10 years of work in order to get insured for Social Security benefits. But once we've tabulated those credits, we do keep track of the dollars because when it comes time to retire, we use this formula to determine what your actual benefit is going to be. So the first thing we do is look at your entire wage career over time. So that's all of the years that you paid in. And we make adjustments for wage levels over time because certainly what we earn in the 80s, 90s much different than what wage levels are now in 2024. Once we've done that, we look for your top 35 years and then we average those. So it's a common misconception that we only look at the last 5 or 10 years. We do actually look at the top 35 years. Once we have those, we average those, and the result we get is something called the averaged indexed monthly earnings. Now, that's kind of a lengthy title there. So, with Social Security, we love our acronyms. So, averaged index monthly earnings, we call AMY for short. And once we figured your AMY, we put it into this computation. And so, this is an example of someone who, after we did that three-step formula, had an averaged index monthly earnings or an AMY of $2,500. That will equate to $1,480 a month in Social Security benefits at this person's full retirement age. But how did we get there? Well, for everyone who is applying for retirement benefits, we get that AMY, and then for the first 1,174 of that $2,500 AMY, we credit at 90%. For any earnings between 1,174 and 7,078, we credit at 32%. If an individual's AMY happens to exceed that 7,078, then anything above 7,078, we credit at 15%. You can see in this particular example, because the AMY of this individual was 2,500, you can see in that third block down, there's zeros. That's simply because this person's AMY did not exceed 7,078, so there's no calculation necessary there. If you go all the way to the right-hand side of this chart, though, and added those totals up, that's how we would get that 1,480 as the monthly benefit. Now, one of the most common questions that we get at Social Security is, when is the best time to retire? And although myself and likely any of my colleagues, if you ask them that question, they would say, well, it all depends. And I know that seems vague, but truly, Social Security does not know what everyone's retirement picture needs to look like. We're not aware of what expenses you might have to meet. So it really is a personal decision, but it is important to have a few tips in mind when you're considering when is that the best time is. So I alluded to on the last slide someone's full retirement age. For Social Security purposes, everyone has an early, a full, and a delayed retirement age. And I like to start by talking about full retirement because, in essence, full retirement is when Social Security anticipated you likely would collect your Social Security benefit. And therefore, they pay you the full amount of your benefit at that time. Now, your full retirement is dependent on your year of birth. And so, for everyone on the call, we're likely going to have a full retirement age between age 66 and 67, but it could vary a little. So, for example, if you were born 1960 or after, your full retirement age is 67. If you were born prior to 1960, it could be 66 and 4 months, could be 66 and a half. Before we leave this presentation, I will show you where to find a super helpful calculator on our website that will let you know what your full retirement age is if you're not sure. But this particular example is showing the example of someone who has a full retirement age of 67. And if they waited till their full retirement age to collect that benefit, they would their particular full retirement benefit is $2,000. They would collect the full amount at that time. Now, if you go to the left-hand side of this chart, the earliest an individual can collect Social Security benefits is age 62. But if you collect any time between 62 and your full retirement age, that is considered early retirement. And two things are true. Number one, the benefits are slightly reduced. And once you take a reduced benefit, that benefit is reduced for the lifetime of collecting it. So it will not go back up when you turn your full retirement age. That's simply to accommodate the additional years we will be paying you. The second thing is there's a maximum you can earn and still collect all 12 checks per year, which I'll get to on the next slide. But let's talk about the financial impact. If you move all the way again to that age 62 on the left-hand side, if this same individual decided to lock their benefits in at age 62, you can see they would lock that $2,000 benefit in at $1,400. In general, it makes about a 25 to 30% difference if you collect early. But you can see by waiting a year, 2 years, the closer this individual is getting to their full retirement age, they lock their benefit in at a little bit higher rate. On the flip side of this full retirement, you see delayed retirement benefits. Now, just like when you collect benefits early, it's slightly reduced. If you wait beyond your full retirement age to start collecting, the government provides you a little incentive. It's something called delayed retirement credits, or DRCs for short. And it equates to an additional approximately 8% per year for every year that you wait beyond your full retirement age. Now you can see if this individual took advantage of this provision all the way to the right-hand side, if they waited till age 70, they would lock their benefit in at 2,480 just by delaying because we'll be paying less time than we anticipated. Now, it is important to note though, if you do take advantage of delayed retirement credits maximize at age 70. There are no more benefits payable for delayed retirement credits beyond age 70. So if you do decide to take advantage of this provision, just know that when you get near your 70th birthday, that's a perfect time to get in touch with Social Security to get that application filed so that you're not missing out on any benefits beyond that. Now, I said a moment ago when you apply for benefits early, two things are true. Number one, your benefits are slightly reduced. And number two, there's a maximum you can earn and still collect all 12 checks for Social Security for the year. This year in 2024, for individuals who collect their benefits early, can make up to an additional $22,320 gross in wages above and beyond that Social Security benefit. Now, note that this limit is only applicable to Social Security wages and self employment. So, other benefits like other pensions or VA benefits, that type of thing will not count against this 22,000. Now, if you were to exceed that amount, though, for every $2 you went over that limit, you wouldn't qualify for $1 in Social Security benefits for this year. Now, the year you turn your full retirement age, though, things are quite different. And I like to use myself as an example to kind of illustrate how this works because my birthday is in June. It's right in the middle of the year. So if you pretended with me for a minute that I was collecting my Social Security benefits early, but now this upcoming year, I'm going to be my full retirement age in June. What this middle bar is saying is that from January through the end of May, I could earn $59,520 just for those 5 months. If I happen to exceed that limit, for every $3 I went over the limit, I wouldn't qualify for $1 in Social Security benefits that year. But once June rolled around, the month of my birth, regardless of what day, once June rolled around, from that month, any month after that, and any year after that, I could make any amount of money that I wanted to, and it would not affect my Social Security benefits. In other words, no benefits would be withheld. Once you're that full retirement age, the world is kind of opened up to you as far as how much employment you want. Couple of things on this provision though. When you do work, even if you've collected your Social Security retirement benefit, you've filed that application, started collecting. When you work, those FICA taxes are still withheld from those wages. So we do check with the IRS twice a year to see if there's any additional funds that we need to give you credit for. So you might see that increase your benefit. The other thing is if you happen to make a mistake, you accidentally do work over this limit and you get some Social Security benefits withheld. It's important to note that those benefits are not gone forever. We also run an automatic accounting of your benefits at your full retirement age just to make sure that we don't owe you any additional funds. So, for example, if we planned to pay you a certain amount and we didn't actually end up doing that because you got some benefits withheld for working over the limit, we would refigure that back into your benefits. So that could cause a little increase in the amount you receive. It would never be as much as if you waited till your full retirement age, but you do get credit for those earnings. Another common question that we receive is whether or not Social Security benefits are taxable. And the answer is Social Security does still allow an individual to elect to get their Social Security benefits without having taxes withheld. But it's important to note that Social Security is taxable income, so it can be taxed for federal purposes. Now, generally speaking, the IRS is the experts on on taxation, but it does help to kind of know or have a foundation of what they use to know if you may have to pay the IRS taxes on your Social Security benefits. So the formula you're looking at in front of you is directly from the irs.gov website. When the IRS is considering this, they are seeking to find something called your combined income. And how they find that is they take your adjusted gross income plus any non-taxable interest that you have, plus 50% of your Social Security benefits. So 50% of what you received from us for the year. And that gives them your combined income. Once they have that, they put it into these brackets. So for 2024, those that file an individual tax return but have a combined income of between 25,000 and 34,000 may have to pay federal income tax on 50% of what they receive from us. If the combined income is more than 34%, then they may have to pay income tax on 85% of what they receive from us. Same kind of formula applies for those that file a joint tax return. It's there in the center of the screen. Just a little bit higher income limits associated, of course, since we're talking about multiple incomes there. Now, of course, this is not a 50% or an 85% tax. That's just the portion of the benefit that the IRS looks at. So we issue you a 1099 at the end of the year that tells them 100% of what you received from us. But when they're deciding what you may owe on taxes, these are the percentage of that they would look at. From there, it's really helpful to talk with a trusted tax advisor or even the IRS who can look at your full tax picture to decide how much you may want to have withheld. So if you found that you did have a combined income that fell into these brackets, a good conversation with a trusted individual would be great. They can tell you how much to have withheld. And then all you have to do is make a phone call to Social Security to request that. You can do it at the time of your application or any time throughout the year. So if you find you need to make adjustments, there really isn't a lot of restriction to it. You just let us know and we'll be happy to make those adjustments for you. Now, in addition to paying the worker themselves, we also have the option to pay family members. This is something Social Security calls auxiliary benefits, and it specifically applies to spouses and children. So, when we look at the spousal benefit, the maximum a lower wage earning spouse could collect off of their higher wage earning spouse is up to 50% of that person's benefit. Now, this day and age, it's quite common that someone might have their own retirement benefit and also qualify as a spouse. And so it's important to note that it's not your retirement plus 50% of that spousal benefit. We always pay the higher of the two. And they did pass some legislation a while back that said that when you apply for benefits, you must apply for any and all benefits available to you. So we do ask that you file your retirement application, and then if 50% of your spousal benefit is higher, then we'll do an application for spousal benefits as well. The earliest you can collect a benefit as a spouse is age 62, but just like with all of our benefits, if you do collect that benefit early, the percentage you collect is slightly less. So it would be slightly less than that 50%. But know that there's no risk involved to the higher wage earning spouse. If a comes on your benefit, it will not reduce the benefits of the higher wage earning spouse in any way. But if the two of you are still married, the higher wage earning spouse must be collecting their benefit in order for the lower wage or earning spouse to collect that spousal benefit. These rules apply in a situation of a divorced spouse as well. But in the case of a divorced spouse, there are a few additional criteria that need to be met. The first one is that the marriage must have lasted 10 years or longer. And you must be currently unmarried in order to collect off of a former spouse. The earliest you can collect is age 62, but if you remarry, you generally cannot look back on a former spouse's record unless your later marriage ends. So if you're later divorced or if later on your second marriage your spouse passes away, then you could look at a former spouse's record again, but you must be considered unmarried in order to collect. Now, in the cases of a divorced spouse, if you've been divorced longer than 2 years, and you know that your former spouse is at least age 62, and you know they've paid in enough to qualify for a Social Security benefit, you can file an application under their record, regardless of if they are collecting their benefit or not. And so Social Security will kind of do that legwork for you when you apply for benefits. We will search any and all benefits available to you. I want to dive a little bit deeper into that mention of a combined benefit. I gave the example earlier that this day and age, it's not uncommon that you might qualify for your own retirement plus be eligible as a spouse. And in cases of that, you may receive a combined benefit. So I kind of want to illustrate how that works. This is our example of Kelly, who has her own full retirement benefit of $800. Now, Kelly's spouse is eligible for $2,000. As a spouse, she's eligible to collect up to 50% of that $2,000 benefit. In her case, like I said earlier, they passed some legislation that said that she has to apply for any and all benefits available to her. So, how do we get her to the higher of the two benefits? Because $1,000 is still higher than her own benefit. So we would first ask her to file her own retirement application and start collecting that $800. And then we would file a spousal application to make up the difference. So in this case, just keeping the math easy, the difference between $1,000 and 800 is $200. So we'd pay 800 on her own, $200 as a spouse. The total is $1,000, the higher of the two benefits. The other eligible family member is children. So if when you come on your retirement or disability benefit, if you have a child who is your adopted, biological, or dependent stepchild, if they are unmarried, under the age of 18, or in high school or below, or if they were found disabled prior to age 22, they may be eligible to collect a benefit off of your record as well. The highest percentage they can collect is up to 50% of your benefit. Again, it has no negative effect on the parent at all. But if there is more than one child on the record, the percentage may be a little bit less to each child because there is a family maximum on each record. Now, family members may also be eligible to collect benefits in the cases where a loved one passes away. For this type of family benefit, we call this a survivor's benefit. And it really involves the same group that we've been talking about. So, a child who is under the age of 18, in high school or below, or found disabled prior to age 22, may qualify to collect a survivor's benefit. The biggest difference here is the percentage they can collect. It's up to 75% of what the parent was eligible to receive. Again, the family maximum applies. So if there's multiple children on the record, it could be slightly less than that 75%, but the maximum would be 75%. Now, in the cases of a spouse, a surviving spouse, things are quite different. As a surviving spouse, you can collect as early as age 60. If the surviving spouse is also disabled, you could collect as early as age 50. Another large difference here is the percentage that you can collect as a survivor. Survivor's benefits are paid at up to 100% of what that individual was eligible for. But just like with all of our benefits, if you lock them in at a younger age, you lock it in at a slightly lower percentage at 71.5%. And here's kind of a side by side chart just to clarify a little bit. On the left hand side, the spousal benefits, auxiliary benefits in the case of the spouse is still living. And on the right hand side, surviving spouse benefits. So on the left hand side, in the life situation, it shows the earliest is 62, highest percentage is 50%. On the right hand side, in the case of an individual being passed away, the earliest you can collect is age 60, 50 if you also are facing a disability, and the highest percentage being up to 100%. Of course, if you lock that benefit in early, it's locked in at that little lower rate, 71.5%. Social Security does still pay a one-time lump sum death benefit of $255 to an eligible family member, eligible spouse, or in the case of a child, if they meet certain requirements. So that's certainly a consideration. The other survivor's benefit that we pay has to do with parents' benefits. These benefits are payable to a parent who is age 62 or older who is receiving more than one half of their support from their child. And although this is a particularly small percentage of individuals that qualify for this, we are seeing an uptick in those who are caring for their aging parents. And so I do like to mention it because if you are caring for your aging parent and the unexpected happened, there may be a possibility for them to collect a benefit under your record as well. So, certainly something to keep in mind if that is a situation that you may face in the future. Okay, before we leave survivors benefits, I want to touch on one exception to a rule I've been saying throughout the whole presentation. I've been saying that when you lock in your benefits at an early age, you take a reduced benefit, and that reduction is with you for the lifetime of collecting your benefits. Well, the exception happens in the case of survivors benefits. There is one exception to that rule. So, what do I mean? Well, let's say the unexpected happened and you had to collect your survivor's benefits early at age 60. But then later on down the line, when you turned 62 or your full retirement age, or even delayed retirement age of age 70, you found that your retirement benefit was higher than what you were currently collecting. You could switch over to your retirement benefit at that later date and collect the higher amount, even though you had been collecting survivor's benefits early. Or vice versa, and maybe this is more common. Let's say you started collecting your retirement benefits at age 62. You would have taken a reduced benefit at that time. But then later on down the line, your spouse passes away, and now you're beyond your full retirement age. If that survivor's benefit is higher at the 100% rate than what you are getting on your retirement benefits, you can switch over and collect that full amount, even though you were collecting your retirement benefit early. I can't stress enough that this only applies during the survivor's benefit realm, though. So you can only switch in between benefits when you're seeking survivors and or retirement. But I do like to mention it here as well because it could make a difference in the calculations when you're trying to plan for the future. Now, many in the community might be facing medical issues that are keeping them from working. And for that reason, they might contact Social Security seeking information about our disability benefits. So for 2024, the definition for disability that we use is an individual must have a severe medical condition that is expected to last 1 year or longer or result in the person's passing. This medical condition must be so severe that it keeps an individual from working up to a limit that Social Security calls substantial gainful employment. For this year, that dollar amount is 1,550. So, in other words, the person's medical condition must be so severe that it keeps them from earning more than 1,550 a month in wages. If the individual meets this criteria, then we will examine their age and their prior work history to seek which type of our benefits would be best for these individuals, because we do have two programs and they are similarly named, and so they're often confused. But on the left-hand side, it's discussing Social Security Disability Insurance, or SSDI. Now, these benefits are supported by the Social Security's trust fund. So, what that means is, in order to draw that benefit out, an individual must have worked and paid those FICA taxes in to qualify for a benefit. And the benefit amount they receive is directly related to what they paid in, very similar to that retirement calculation we looked at. On the right-hand side, we also support a program called Supplemental Security Income, or SSI for short. Now, this is paid from a general treasury fund. It is not paid from the Social Security Trust Fund, and we primarily use it for individuals who might have been disabled at a young age, and maybe didn't have a lot of opportunity to pay those FICA taxes in through work. And so they may have a lower benefit amount. Or maybe they didn't have an opportunity to pay in at all. For example, we use this program a lot for children. Biggest difference here, though, is that this program is an income and resources based system. So we do look at income and resources for the household when we're determining whether someone is eligible for this benefit. So, for example, a child, we would look at the parent's income and resources. In any case, when a person applies, we do investigate both of our types of benefits to ensure that we place the individual where they can really maximize the benefit they can receive per month. Now, a conversation about disability is a good lead into talking about Medicare, because an individual who qualifies for Social Security Disability, or SSDI, will qualify for Medicare benefits a little early after they have receiving the SSDI benefits for 24 months. On the 25th month, Medicare eligibility will kick in. Also, those facing some more severe medical conditions like ALS, commonly referred to as Lou Gehrig's disease, or kidney-related issues, they may be eligible for Medicare a little earlier than they thought. This is based on treatment plan. So I always stress that if you know someone or you yourself are facing either one of these diagnoses, just please get in touch with Social Security. You may be eligible a little bit sooner than you think, and we'll be happy to take a look at that for you. But for most of us, we'll be looking at Medicare in our retirement, and our earliest opportunity to do that is age 65. And the first enrollment period at 65 is called our initial enrollment period. Now, this initial enrollment period lasts a total of 7 months. So it starts 3 months before an individual turns 65. It lasts through their 65th birthday, and then lasts 3 months after their 65th birthday. So you have that full 7 months to decide whether you're going to bring on Medicare coverage at that time or not. If you're currently on Social Security benefits, you'll be automatically enrolled in Medicare. If you're not on Social Security benefits, then you'll need to file an application with Social Security to get started. Now, you do have a few options here. Some may not choose to enroll during the initial enrollment period, and that's okay, except there is some risk associated with it. And so, in order to not be under that risk of receiving any type of surcharge or penalty, you'll want to make sure that you meet the special circumstances required. So, for example, You may not need to bring on Medicare because you're working and covered under a group health plan. If that's the case, you're okay to delay. Or your spouse might be working and you're covered under their group health plan. If that's the case, you're okay to delay. And then when one of those situations changes, you would enroll under something called the special enrollment period. But it is important to note that once one of those circumstances changes, you only have 8 months to get enrolled in Medicare. And there is an additional document that would be required for your employer to sign to prove that you had been working and covered under that group health plan from the time you turned 65. Now, if both of those enrollment periods pass you by, every year there's a general enrollment period between January 1st and March 31st. And any eligible individual can apply during that time. But note that if you didn't apply during your initial enrollment period and you did not meet one of those special circumstances we just discussed, you could receive a surcharge on the amount that you pay for Medicare each month. And it equates to 10% for every year that you were eligible but didn't take the coverage. So for example, if 3 years have gone by, that's a 30% surcharge. That means you'll pay whatever the base fee is for Medicare plus 30% forever. It never goes away. So I can't stress enough to please that when you turn 65, please get in touch with us. We can answer any questions that you may have. Please consider whether you meet those special circumstances so that you're enrolling at the right time for you. That being said, Medicare has four parts: A, B, C, and D. Hospital insurance, or Part A, covers you when you're an inpatient in a hospital for one night or longer. If you have those 40 credits, in other words, you paid those FICA taxes, that percentage of Medicare goes to support hospital insurance. So you will receive that free of charge. Part B, as in boy, is medical insurance. This is doctor's office visits, emergency room visits, lab testing, things like that. Kind of the more common things that we use our medical coverage for. And it has a monthly premium. This year it's 174.70. Now that does vary from year to year. It does go up and down, it fluctuates. But for 2024, it's 174.70. And the two of those together is considered original Medicare. Those are the two parts that you sign up with Social Security for. Once you've obtained those, then you can kind of move to the other parts. I'm going to skip to the fourth part, prescription drug plans. You can choose a standalone prescription drug plan and retain your original Medicare. You can also add a supplemental plan like a Medigap policy that would kind of help you meet any annual deductibles associated with those plans or any co-insurance associated with those. Or on the right-hand side of this chart, it exhibits the third part of Medicare, Part C, like CAT, or commonly referred to as Medicare Advantage plans. You have the option to select these private health plans that take over the servicing of all parts of your Medicare, but they run a little bit more like group health plans. So instead of paying annual deductibles and co-insurance, for example, you may just pay a co-payment at the doctor or a co-payment at the emergency room. They also include some additional benefits that Medicare Original does not cover. So like vision, hearing, and dental, often some fitness programs, that type of thing. These are the programs that are being advertised on TV by former football stars, or if you're nearing 65, you're probably getting flooded with advertisements for these, but they are not required because in many cases they have an additional fee. So it is a choice you can make to go through one of these Advantage plans. When you're approaching this decision, though, it can be pretty daunting. So I always make reference to Medicare's website at medicare.gov because they have such a great tool where you can put in your zip code, the doctors that you see, prescriptions that you take. So it takes this list of literally hundreds of these plans available down to the ones that would best suit your needs. So try that calculator out when you're approaching this decision. If online services are not your thing, that's fine. Call 1-800 Medicare. Their representatives will be happy to help you make the decision whether you want to bring on these additional plans or not. Okay, so we've covered all these benefits. How do you get them when it's time? Well, I always make reference to our online applications. We have worked so hard in the last few years to simplify this process. You can apply for any of our benefits online, including retirement, spouses, disability, just Medicare, a combination of any of those benefits. For example, if you're not sure if your spousal benefit is higher than your retirement, file that retirement application. We ask you marital questions on that application, and we will screen you for the higher of the two benefits. The only application you cannot file online is survivor's application. So if you are planning to apply for survivor's benefits, feel free to call our 1-800 number on the screen. It's 1-800-772-1213, and we'll be happy to schedule you an appointment to meet with one of our representatives by phone or meet with one of our representatives face to face in one of our offices. A good place to start your planning process, though, is to go to ssa.gov. On the left-hand side, you see a prepare section. All of the information I've shared comes from that prepare section. And although we don't provide copies of our slides because there is changes of legislation throughout the year and we really seek to have the most current information out to you, I did provide the coordinators of this presentation website information for every slide that I have in my slide deck. So it's links directly to this information, but it's all under the prepare section. That's also the area where you can find out where your full retirement age is. There's a very simple calculator in there where you can put in your date of birth and it will tell you immediately what your full retirement age is. If you need drilled down information though about your record, if you look at that navy blue band across the top, all the way to the right-hand side, there's a sign in option. That will direct you to our My Social Security accounts. The first step in signing up for a My Social Security account is to set up a login.gov or an ID.me credential. If you already have one of these with another government agency, perfect. You can use it to kind of make it simpler to access all of your time without having to have a lot of username and passwords. If you have an older account where you do have a username and password, you'll soon be prompted to set up a login.gov or an ID.me credential just to kind of get all of our accounts on the same page. But it's super helpful to have a My Social Security account before you come on benefits because you can review your retirement benefit estimates, the numbers that are specific to your situation. You can replace your Social Security card. You, of course, file your application within there. You can also look at a detailed earnings record. So if you click on our earnings tab, you can look at your entire earnings record, which I highly recommend doing just to make sure we have everything accurately reported. You can also look at a quick snapshot of your benefits, the Social Security statement, where it just gives you a quick snapshot of 9 different ages, what your benefit amounts would be. Gives you a quick snapshot of your earnings. The most current years are on display there. It also provides an age-related fact sheet, kind of the most common questions that your age group asks Social Security. So we touch on those answers for you. And if you're 62 or above, you'll also receive a Medicare fact sheet as well. Also very, very helpful to have one after you come on benefits because all the notices that we send will be available to you online in a database. You can download benefit verifications if you need to prove your earnings to other agencies. You can make simple changes like address, phone number, direct deposit, all without having to wait on our phone lines or come into our offices. You can view your tax information for Social Security purposes. You can also advance designate an individual to handle your benefits if something were to happen. So this is something called advanced designation of representative payee. If you became incapacitated for any reason, we could appoint a person to handle your benefits on your behalf. What this makes easier for Social Security purposes and safeguards your benefits is that we allow you to list at least three trusted individuals who you would be okay with handling your benefits if the unexpected happened. I highly recommend listing individuals there. You don't have to list three, you can list just one, you can list up to three, you can change them at any time. We let you know annually who you have on the record, but it is very, very helpful to expedite the process if you become incapacitated to get family members information that they might need on your behalf. It also helps Social Security know that we are selecting someone who you would trust with your personal information. So please do advance designate when you come on benefits. It's super helpful for the future if the unexpected were to occur. If you use social media, if you like to use social media, please follow Social Security. That is another place where we put all of our new changes in legislation and new updates. So if you're trying to keep on the cutting edge of what's going on with your benefits and with the agency as a whole, please follow us on social media in addition to checking with ssa.gov often. And with that, I'm going to just display this slide regarding your Social Security card. If you happen to need a replacement Social Security card at this time, feel free to scan that QR code. Our online applications are very simple to use for replacements of Social Security cards as well, and you can likely save yourself a trip into the office by applying online. So I'll leave that displayed. I'm going to transition to the chat here to see if I can answer any questions that may have been posted. Let's see. I don't see any yet. I'll give you a few minutes just to post any questions that you might have for me in the chat. I will be happy to address those questions. Like I said, I'll just give it a minute here. I'll get a little sip of water while we see if there's any questions out there you might have for me. Okay, so it does look like we have a question that posted to the chat that says, on the Social Security statement, I see that 1 year I have is $0.00. I know I paid in money that year. How do I get Social Security to correct that? I went to the web link that they provide to correct errors. However, they were not able to direct me to any web link to fix the issue. What do I do to correct the error? Great question. Um, You'll need something from the IRS that shows what you paid that year. So if you still, depending on how far back this year goes, if you still have your tax return, that's what we will use to correct that error. And in that case, you just need to, if you want to handle it by mail, you can write a quick letter saying, this is not correct on my record. Here's a copy of this. I need to have it corrected. You can call us, we can enter it into the system, and then you can follow it up with that proof. Or you can walk in that proof right into a local Social Security office and we will fix it for you. If it happens to be a year that you don't have your tax return on anymore, or you don't have that W 2 anymore, we can also use a transcript from the IRS. So you can call the IRS and say, I need a transcript of my taxes for the year, whatever year it is. And they can provide you a printout and you can provide that to Social Security in either one of those forms that I just discussed, and we'll get that updated. We always do when you apply, have you review your earnings record. So even at that time, if you're close to filing, getting ready to file that application, obtain those documents, and then you can supply it with your application as well. And we can correct it at that time. So you do have several options if you need to get that corrected. The next question that posted, I'm over 65 and working full time and covered by a group insurance. You said I have 8 months to apply for Medicare. Is that 4 months before I end full time and 4 months after, or based on my birth date, or how does that work? So it's 8 months from the time that situation changes. So you're working and covered by the group health plan. If that group health plan ends, you have 8 months from that time period. Or if you stop working, you have 8 months from when you stop working to get those documents into Social Security. So that the times kind of starts when that situation changes. Um, until then, you don't really have to take a lot of action. But I always suggest when you're approaching retirement, if you know a month or 2 in advance, since there is that extra document that needs to be completed, you can give Social Security a call, we'll mail you out the form, and you can have it signed, then you're set and ready to go. The sooner you get in touch with us, the better, because it does take us a little time to process applications right now, so, you'll need a few months to do that, so if you're anticipating you're gonna retire soon, request the form, and that'll get the ball rolling for you. I didn't see anything else post to the chat. I'll give it just a couple more minutes to make sure that I give everybody an ample opportunity. Let's see here. Okay, well, I think I might have answered all three of them. Let's see here. You see if I can flip into the other screen. I just want to make sure I get them all answered. I think so. Well, in that case, I won't keep you any longer. I know sometimes in a public forum, it's difficult to maybe you don't want to share that information. So certainly you can get in touch with Meg. She knows how to reach me if there is something that might come up after the presentation. But I do appreciate you having me in today to talk about Social Security benefits. And I guess I will hope everyone has a nice afternoon.
Thank you, Ivy. It's always a pleasure to have you.
Thank
Thank you
you.
for joining us.